You're watching ABC 36 on your side. Good Day, Kentucky.
Well, today we are joined by Dr. Marc Parazino with UK Healthcare, breaking down the benefits of sports cardiology. Thank you so much for coming in today.
Of course. Thank you for having me. I appreciate it.
So, Doctor, if you can give us kind of your elevator speech on sports cardiology for folks that sounds vaguely familiar, but maybe not quite on track for what it is that you do.
Of course. So I get asked this question often, what is sports cardiology?
Right.
And I tell people this is general cardiology. It's just applied to a specific patient population, that is athletes or highly active individuals. This is a field that has really gained momentum in the last 10 to 12 years, perhaps a little bit more rapidly as of recent with some of the high-profile cases that have gained national attention. But I think the value of a sports cardiologist is in the skills and the education, knowing what's normal, what's expected in an athlete, versus what symptoms may be worrisome and deserve a little further investigation.
And just for my clarification, too, how athlete of an athlete are we talking about?
No, I think you're exactly right, is that you don't have to be an elite level athlete to gain benefit from seeking specialized care from a sports cardiologist. People who are active, maybe they need to be active for work, they just like to exercise, can all benefit. That can be people who are running 5Ks, half marathons, marathons on the weekends, masters swim athletes, people who just want to start an exercise program, or active people at work, whether that's law enforcement, EMTs, or military. They can all benefit from seeing somebody from like a sports cardiologist.
Right.
Yeah,
so
absolutely.
we're in there somewhere.
Yeah, we are.
Okay, this is good.
Okay, so let's talk about this a little bit more too. With being a cardiologist, what do folks need to look for, signs or symptoms that they should be aware of?
Yeah, of course. I talk a lot with my patients, about what I refer to as effort-dependent symptoms.
Yeah.
So the more you exercise, the more you run, the more you cycle, do the symptoms get worse?
Okay.
And do they seem out of proportion to your level of exertion, right? Because we all are out there running, and we know that you get deep into a run and you're feeling, shorter breath maybe. And so you have to ask yourself, does this seem out of proportion to what I would expect? And if this is becoming a pattern, something you're seeing over and over again, maybe it's time to kind of shut things down, kind of hold off on training and talk to your provider, whether that's your family medicine provider, whether that's a cardiologist or sports cardiologist like myself.
Yeah.
And you probably get this a lot with patients too, especially those high-performing athletes. How many people just start to live with these symptoms and these problems and say, oh, I'm just, tomorrow will be better. And then the longer they wait, it makes things more difficult for specialists like you.
Of course, absolutely. And I think that's a lot of the benefit of understanding sports cardiology and understanding what is normal. And so, like I said, what is expected in an athlete, and really kind of honing in on that specialized care.
So if someone is interested in, really getting into exercise and starting off, what would be your recommendations for that person?
Yeah, my patients probably get tired of me saying this, but I tell them, understand your risk factors for heart disease, understand your family history, and sort of pay attention to symptoms, right? If you're somebody who does not have a lot of risk factors for heart disease, you don't have a strong family history, it's most likely safe for you to get into exercise and kind of starting an exercise program. But if you are somebody who has a lot of risk factors and you have a really strong family history, talk to your provider about this. That's the most important thing you can do, is to understand that and modify these risk factors.
Yeah.
And sometimes there's testing that we can do to recommend, whether that's something simple like an EKG, an electrical tracing of the heart, or something more complex like stress testing, to get you to exercise and do it safely. That's the goal with sports cardiology.
So even if there are risk factors involved, folks can still ease their way into this without to do harm coming to them,
absolutely.
right?
And to your question before about what kind of people are we seeing, it's not just athletes and active people. It's people, maybe they had recent heart surgery, or maybe they were just diagnosed with heart disease. They want to get to exercise and they want to do it safely. There's really good data in these patients to undergo supervised cardiac rehab. And at the UK Sports Cardiology Program, we can sort of take that one step further. And using metabolic exercising data, we can actually give you individualized prescriptive exercise regimens. We can get you back to doing what you want to do and what you love to do quickly and safely.
Love that.
Sounds really good. And despite the technology, despite the advancements, in the field. It always comes back to that relationship, doesn't it,
Yeah.
between doctor and patient?
Absolutely.
So
Absolutely.
where can folks learn more about this particular line of work?
Yeah, absolutely. I mean, this, like I said, this is a field that is really gaining momentum in the last little bit here. And, Gilhart has a great website that talks about this, but, the American College of Cardiology has a sports and exercise page with a lot of information about it online as well. But check out the Gilhart website for more information. Be happy to help out, patients and athletes, people who want to be active in any way possible.
Wow.
Well, we want to get smart on this.
Yes,
Even,
we do.
Even for us that like to think we're more athletic than perhaps we
Kinda.
actually
We're
are.
kind
But,
of so-so.
Doc, we appreciate it.
Yeah, absolutely.
Thanks
Thanks for
so much
having
for
me.
coming in.
Back with more after this. Stick around.